Good morning. It's Monday, the 4th of May. I hope everyone had a wonderful weekend and that it was relaxing and full of fun activities in front of the TV. I know that's sort of how Pat and I spent our weekend. We're going to go ahead and start our COVID-19 daily task force meeting, and we're going to start at the board. Let's zero in on the latest map. And the two things that I think are interesting as we examine this map is to notice that the hot spots that have always been the hot spots continue to be the hot spots. The Tennessee Valley, Detroit, Chicago, the whole Northeast corridor, Miami-Dade, Broward, Palm Beach counties. But here is the really interesting thing. If you zero in right down here on these bright yellow and orange dots, those are cities in excess of 450,000 population. And so you can see Tampa, Pinellas, St. Pete, and look at how much of the orange and yellow you can see. So high population, good density level. But look at how well Pinellas County has done in controlling the outbreak of COVID and our response as a broader community to this virus. All right, let's dig into our local community numbers. Here in the state, we have just slightly over 36,000 cases. There was an increase of about 3,000 over the weekend, 3,000 new cases. This is one of the things that we are going to continue to see. Even though the governor has announced that this morning we are entering phase 1 of the lifted restrictions, that does not mean that COVID is still not out there, and most of the health experts are predicting a spike as we reintroduce ourselves to a broader community life and we lift travel restrictions. So we did see a 3,000 people increase in the number of new COVID cases reporting to hospital. Our death toll here in the state of Florida is 1,379. In Pinellas County, we did a little better. We have 766 cases, and that's up just about 30 cases over the weekend. And our death toll climbed from 37 to 41. So again, much more modest in terms of an increase of numbers. Pasco County continues to provide good numbers. They are at 278 with 8 deaths to date. In the United States, we're at a little over 1,000,001 and over 67,000 deaths across the United States. If we look at what's happening here in Pinellas County specifically, we've had 233 hospitalizations, and in our specific zip code, there have only been 16 hospitalizations. So what we're doing is working and paying off for us. One of the things that I wanted to share this morning, we track these numbers. I've not been sharing that on a regular basis, but I wanted to talk a little bit about the testing that's going on here in Pinellas County. So far, they have administered 15,819 COVID tests, with 766 of those reporting positive. That means that over 14,000 of those tested have shown to be negative. If you do the percentages, that's about 4.8% of the population that is testing negative for the, 4.8% of the population that is testing positive for COVID, but the vast majority is showing negative. So we will track those numbers day by day and continue to see which way they go. The significance here is only 15,000 people in Pinellas County have been tested. There are almost 1 million residents in Pinellas County, so we are well short of the 2% of individuals they need to have tested in Pinellas County to be able to do a proper statistical analysis and build a model for what the COVID is going to look like going forward. This is a priority with the state, although the vast majority of the testing right now is occurring in Hillsborough County because their situation is more dire than what we find ourselves in here in Pinellas County. At local community numbers, our number of residents that are currently being quarantined is 15, 6 in the independent living, all of those related to someone who went to the hospital and is having to come back and self-isolate for 14 days. Same situation in the skilled nursing and assisted living. We currently have 9 residents that we are monitoring and that are under self-imposed quarantine. There are no staff members currently that are prevented from coming to work, and our number of flu-like symptoms that we are testing for COVID, we have 1 resident, but we are not expecting that individual to come back positive. They are not showing any symptoms whatsoever, but we elected to test them as a precaution. In our number of confirmed COVID cases, we still remain at 1. Patient 0 tested positive Saturday, and so he continues to go back and forth. He must have 2 negative tests in a row before he's eligible to be discharged from the acute care center. So as you are aware, today is day 1 for Florida in entering phase 1, the lessening of restrictions and getting Florida back to work. Shelter-in-place orders are still in place. That doesn't mean that you're not at this point allowed to go outside, to get in your car, and to go someplace other than a grocery store. The president and the governor have opened up some businesses in Florida, retail stores and restaurants. However, there are restrictions to those openings. In restaurants that are reopening, no more than 25% of normal capacity is going to be allowed, and the same is true for shopping, whether it's TJ Maxx or Home Goods or the mall. It's only going to be open up to 25% of capacity. Elective surgeries can now resume, and so hospitals are opening up their intensive care wards and general beds to elective surgeries and post recovery. Bars, gyms, beauty salons, barbers, any kind of personal service, and movie theaters have not been reopened. Those will be opened in phase 2. So any place that requires one-on-one personal service or large group settings like sporting events and movie theaters, those have not been reopened at this time. These changes went into effect throughout the state with the exception of 3 counties, and those are our South Florida counties of Miami-Dade, Broward, and Palm Beach. Here at Regency Oaks, we are starting our discussions about what is going to be lifted and what restrictions are being pulled back, and we will be rolling those out this week. I can tell you that initially we have made a decision on layering back out 2 restrictions and starting to ease into reopening the community. The two restrictions that we've decided to lift is the restriction of going between the buildings. So effective this morning, north residents will be able to go to the south, and south residents will be able to go to the north. So any restrictions between the buildings is going to be lifted. The second thing that we are lifting this morning is the thing that went in place last, and so we're removing it first, and that is the form that you are required to fill out if you leave campus and return. It's no longer going to be necessary for you to stop at the desk and fill out the form advising us of where you went and who you saw and who you might have been exposed to. We are still recommending that if you leave Regency Oaks and return, that you continue to have your temperature checked by logging in at the front desk, that you continue to wear your mask, that you practice good social distancing, no closer than 6 feet, nor more than 4 people in any gathering, and most importantly of all, good sanitation and hygiene, washing your hands for 20 seconds, using a disinfectant in between proper hand washing. All of those safety measures are recommended, and we encourage you to continue to follow through in those areas. So for this week, we will continue with the 5 thoughts of the day, and we will continue with the Monday, Wednesday, and Friday COVID updates through 7/32. We will continue to provide you with information about how we are going to roll out the change and start layering back the restrictions in dining, activities, and transportation. So more on that will come. For today, that's going to wrap up our remarks. I hope you have a great day, and we will see you on Wednesday. Thanks so much for joining us.